Warmer spring weather means many people are ditching the socks and boots and grabbing open-toed shoes like sandals and flip-flops as you head out each day. Are your feet ready for this change? We are breaking this down in today's two-year well-being segment. Dr. Adam McDonald with Triad Foot and Ankle Center is here with us today to talk all about it. So first up, why is taking care of your feet? Why is that important?
Hey, thanks for having me today. It's really important. Your foot's the first thing that touches the ground in the morning when you get out of bed, supports the whole body, and you really got to take care of them for long-term health. A lot of health issues can originate or show up in the feet, and they connect all the way up to the hip and into the back. So taking care of those and supporting them will help your overall health and your alignment and the rest of your body position.
So you see a lot of stuff throughout the day, I'm sure. So what are some of the biggest issues you see with foot health that could be avoided if people just took better care of their feet?
A lot of it starts with fairly simple things that you feel like may get better on their own, but don't over time, whether it's a roll of the ankle or a small pain or even a small change in the skin or something that you see, you think it's just going to get better. And you kind of ignore it for a while and it gets a little bit better and then it gets worse. And then at that point, it could turn into something long term like an injury or damage to the joint or the tendon.
So Dr. McDonald, here's another question. A lot of us are going to be switching from boots to sandals and other open-toe shoes. What are some do's and some don'ts for preparing our feet?
One of the big things I see a lot of times this year are overuse injuries. So warmer weather, people start moving into to running and jogging and biking and getting out and trying to exercise, get off that winter weight like a lot of us get, and wearing an old pair of shoes that they've had for 3 or 4 years, and they start getting injuries from that. So even when you're moving from shoes, from your winter boots to running shoes to sandals, flip flops, you want to make sure your foot's well supported. So a good rule of thumb, or maybe in this case, a rule of toe that I always tell my patients is make sure that shoes support you in the right area. So motion in a shoe towards the toes is good. It should bend there because we need that motion. But if it bends a lot, or you can fold it in half, like you're folding a book up in half, then it may not be supporting your arch or in the heel, and you may need to get a new pair of shoes that's a little more supportive. Even the sandal or something that's got a better arch support can be found.
What about some of the don'ts? What about more of those?
As far as taking care of the feet, yeah, like I said, sometimes you get that old pair of shoes out and you may try to wear it from last year and may still not support you because they don't last forever. Taking care of your skin health too as you come out of winter. Usually the skin's really dry, so making sure you've got some good moisturizer, good lotion on that to keep that skin from cracking as you start getting out. And then another thing is sunscreen too. So we always think about putting sunscreen on our face, but this week especially, a lot of people going on spring break, going down to the beach, going to the coast or further south. Make sure you got good sunscreen on the feet because skin cancer can happen in the feet too.
Great advice there. So I love to get a pedicure, and I like to do it when it's cold. I like to do it when it's hot outside. So when it comes to a pedicure, what are your recommendations? How often?
How often? I typically leave that up to patients. When something's starting to hurt, whether it's a callus or a toenail causing a pressure on the corner there, is it's okay to do that. However often you need to. I do typically recommend patients that have other health issues that put them at risk, such as diabetes, circulation issues, or poor sensation in their feet. Probably should avoid getting pedicures on a regular basis unless those things are very well controlled or have been evaluated by a physician.
What are some signs people should look out for after a pedicure to indicate if there might be a problem?
A lot of times a common thing that I see after is possibly like an infected nail that happens when maybe the technician got a little bit of the skin or got too deep. So redness and swelling around the nail or any kind of drainage that wasn't there before. The other thing I'd often see too is nail fungus or athlete's foot that develops after, which usually shows a discoloration in the nail or peeling skin. And if you develop any of those things, it's a good idea to have it evaluated by a podiatrist or a physician to see if it needs any further treatment.
So what about ingrown toenails? How can you prevent those?
I usually recommend cutting the nail straight across instead of down into the corner. A lot of times when you cut down into the corner, you may get some of the skin and cause an infection. That causes then swelling, and the nail continues to grow down further. And again, if you have something like that, often something you can do simple at home to see if it alleviates it is a soak in like a warm water bath for a few minutes, a couple times a day, and see if that alleviates. And if it doesn't get better in a few days, then having it evaluated is a good idea.
And so what should you do if you think that you might have an ingrown toenail?
Yeah, that's something that we definitely see quite a bit of. I usually see a number of them in a day, and having it evaluated by a podiatrist at Tried Foot and Ankle would be a good idea to take care of it. We can sometimes it's as simple as just trimming part of the cornerback or putting you on antibiotics, and sometimes it requires a procedure in the office to remove the ingrown toenail, either temporarily or permanently.
So here's a question for you. Some people might actually be a little bit embarrassed about it, so I'm going to go ahead and ask the question, what about stinky feet? What causes it, and what can people do to prevent it?
Yeah, it's nothing to be embarrassed about. A lot more people have it than you think. It's usually caused by either a bacterial or a fungal infection on the skin, especially this time of year as we go to warmer weather. Those of us that work in closed shoes all day, especially outside in the summer, it can happen very easily with. So people that have a lot of sweat on their feet, it's a good idea to change socks midday through your work shift sometimes, and that keeps those areas dry because those types of bacteria and fungus love to thrive in a warm, moist environment. Hygiene is where it all starts too. Washing between the toes and drying really well between the toes is important, and sometimes that means more than once a day. Sometimes it requires either an over-the-counter antibacterial ointment or even an antifungal ointment. And then if those things don't get better, having it evaluated for prescription may be necessary too.
So washing the feet multiple times a day can help with that stinky smell.
Yep.
Dr. McDonald, it's getting warmer outside. A lot of people probably like walking outside without their shoes on. Maybe they like walking inside the house without shoes. Are there any concerns or dangers when going barefoot?
I think in healthy patients that don't have either, like I said, diabetes or circulation issues, same thing with pedicures, that going barefoot is okay if you don't have those conditions. Those patients that do have those conditions, you want to be cautious with and almost never go barefoot because you could step on something, cause an infection. My general rule of thumb for most patients too, if you're comfortable doing it, it's usually okay. But if you're having pain or having issues with your foot, then going barefoot is probably not going to help those things.
So if someone is thinking, my issues, they aren't bad enough to see a doctor, or I think it's going to be better, let me put some ice on it, what would you say to those folks?
I think it's great to try those things. That's what I do when I have an injury. But if those things aren't getting better, having it evaluated is a good idea, because the longer you delay, the more serious these things can get, and turn from a small issue that is short term into a longer term issue that could have permanent damage. I see that a lot with heel pain or tendonitis, where someone has an issue that they start doing stretching and icing and it gets better temporarily, but then it comes back and you kind of ignore it and put it off because you're busy with work or other responsibilities. And then long term, that can turn into irreversible damage in the joint or in a tendon. And you don't want to have those things because they're much easier to treat sooner rather than later.
And, just how quickly could someone get an appointment with Cone Health with a podiatrist to address foot health concerns? Kind of explain that process.
For any kind of urgent or emergent issues, we have same-day appointments. If you go to our website at triadfoot.com, it's got all our office locations listed. We're in Greensboro, Burlington, Kernersville, and Asheboro, and we've got a number of doctors that have availability each day for urgent or emergent appointments.
And is a referral needed for that if someone wants to go ahead and take that next step?
It typically depends on an insurance plan, on what your coverage is, if it requires a referral or not. But our schedulers will be able to look into that information for you and decide that, and let you know when you call. And we can usually help with that process as well.
Awesome. Well, thank you so much. We definitely learned a lot today. And if you miss any of today's segment, head over to the To Your Wellbeing section of our website on WFMYnews2.com.